Hi, myself Dr. Vivek Sasindran, and welcome to yet another episode of ENT Talks. Now today, I would be clarifying certain doubts regarding cholesteatoma. In fact, we had comments from our subscribers asking me to describe cholesteatoma in detail. Well, when I talk about cholesteatoma from an ENT perspective, we are talking about cholesteatoma in the ear most of the times. Now, you can have something similar to a cholesteatoma in different areas of the body. For example, the brain, where it is referred to as an epidermoid. So it's nothing, basically the skin in the wrong place. So you could probably look back at our previous videos where we explained this whole things in detail. So these patients usually present with ear discharge, foul smell, it can be blood stained, they can have hearing loss. Now, this is generally a surgical disease. So there is no role for medical management. The earlier you operate, the earlier you clear the disease, the better the outcomes. Now, there is a difference in the patterns of cholesteatoma in adults and in pediatric age group. So what you need to understand is that in the pediatric age group, the cholesteatomas tend to be more aggressive when compared to the adult patients. Adult patients, yes, obviously over a period of time, it can cause extensive bone destruction, no doubts. But pediatric cholesteatomas are a different ball game altogether. So many a times, our primary aim would be to kind of clear the disease radically. However, these patients have to be kept on a regular follow-up because there is always a chance of a residual disease behind, or there could be a chance of recurrence over a period of time. So keeping this point in mind, we sometimes advise or advocate a second look surgery. So if at all we have any suspicion at the time of follow-up that there is some residual cholesteatoma, there is evidence of recurrence of cholesteatoma, then we would go in, re-explore the previously operated site to ensure that there is no disease left behind. We also advise this when the patients have very poor hearing after the first surgery. In the sense, we usually attempt hearing reconstruction in the primary surgery. However, there are few situations where we may not be practically getting the desired kind of hearing outcomes. So in those situations, for improving the hearing outcomes, we again advocate a second look surgery, which is usually done few months after the primary surgery. Thank you.